Have you ever heard of a disease called sarcoidosis? It's not exactly a household name, and yet this rare disease has the potential to impact any of us. Sarcoidosis is a bit of a mystery in the medical world, a condition that can affect multiple organs in the body, often starting in the lungs or lymph nodes. It's characterized by the presence of tiny clumps of inflammatory cells known as granulomas that can appear anywhere in our bodies. While these granulomas are usually harmless, if they become too numerous or appear in sensitive areas, they can cause a variety of health problems. Understanding sarcoidosis is crucial, not just for those who are diagnosed with it, but for all of us. After all, knowledge is power, especially when it comes to our health. Now, you might be wondering what causes sarcoidosis, right? Let's dive into that. So, what causes sarcoidosis? Well, that's a good question. The answer isn't as straightforward as you might think. Currently, the medical community doesn't have a definitive answer for what causes sarcoidosis. What we do know is that it's likely related to an abnormal response from the body's immune system. You see, normally our immune system works to protect us from foreign substances like viruses and bacteria. But in the case of sarcoidosis, for reasons we don't fully understand, the immune system starts to overreact, causing inflammation and the formation of granulomas, or small clusters of immune cells, in the body's organs. This can occur in various parts of the body, primarily the lungs, but also the eyes, skin, and lymph nodes, among others. While the exact trigger of this immune response is still unknown, there are several theories. Some researchers believe that sarcoidosis might be caused by the body's reaction to specific types of bacteria, viruses, or chemicals. However, not everyone exposed to these substances develops sarcoidosis, suggesting that other factors must be involved, and that's where genetics come into play. Studies have shown that the individuals with certain genetic factors are more likely to develop sarcoidosis. This suggests that there's a genetic component that might make some people more susceptible to the disease. Environmental factors may also play a role. For instance, exposure to certain chemicals or dust particles, particularly in the workplace, has been associated with a higher risk of developing sarcoidosis. Even with these potential causes, it's essential to remember that sarcoidosis is not contagious. It does not spread from person to person, and it's not something you can catch from someone else. So, in a nutshell, while we don't know the exact cause of sarcoidosis, it's likely due to a combination of an overactive immune response, genetic factors, and environmental exposures. The causes of sarcoidosis might be complex, but understanding the symptoms can help with early detection. Now let's talk about the symptoms. What should you look out for? Sarcoidosis is a chameleon of sorts. It can present with a myriad of symptoms, or it may not present any symptoms at all. This variability is due to the fact that sarcoidosis can affect almost any organ in the body, though it most commonly targets the lungs and lymph nodes. One of the most common symptoms of sarcoidosis is a persistent dry cough. This isn't your ordinary run-of-the-mill cough that's here today and gone tomorrow. It's a cough that sticks around, causing discomfort and concern. Now, imagine feeling tired all the time, like you've just run a marathon, but you haven't done anything strenuous. That's another common symptom, fatigue. It's a kind of tiredness that sleep doesn't seem to fix, a fatigue that's more than just feeling sleepy. It's a deep-seated weariness that can make the simplest tasks seem like monumental challenges. Shortness of breath is another common symptom. This isn't just being out of breath after climbing a flight of stairs. It's a feeling of not getting enough air, even when you're at rest. But remember, these are just the common symptoms. Depending on which organs are affected, sarcoidosis can cause a variety of other symptoms. It might cause skin rashes or bumps, red and teary eyes, or even arthritis. In some cases, it can affect the heart, leading to irregular heartbeat and other complications. And then there are those who experience no symptoms at all. For them, sarcoidosis is often discovered accidentally during a routine checkup or an unrelated medical examination. The wide range of symptoms makes sarcoidosis a difficult condition to diagnose. But it's important to remember that if you or someone you know is experiencing these symptoms, it doesn't necessarily mean they have sarcoidosis. These symptoms can also be associated with other conditions, so it's crucial to seek medical advice. Recognizing these symptoms can be the first step to seeking treatment. Let's explore the treatment options for sarcoidosis. What can be done if you or a loved one is diagnosed with sarcoidosis? This is a question that looms large when one is grappling with the reality of this condition. In this segment, we will delve into the various treatment options available for sarcoidosis and how they can help manage the condition effectively. Let's begin with medication. The most common first-line treatment for sarcoidosis is corticosteroids, particularly prednisone. These drugs are potent anti-inflammatories that can help reduce the inflammation caused by sarcoidosis. However, they do come with potential side effects such as weight gain, mood changes, and osteoporosis, so their use must be carefully monitored. If corticosteroids are ineffective or can't be tolerated, other medications like methotrexate or azathioprine may be prescribed. In certain cases where inflammation is localized to a specific organ, doctors may opt for a targeted therapy. For instance, if the eyes are affected, steroid eye drops can be used. If the skin is involved, topical creams or injections may be employed. In addition to medication, lifestyle changes can play a significant role in managing sarcoidosis. Regular exercise can help maintain lung function, while a healthy diet can support overall well-being. It's also important to avoid exposure to substances that can harm the lungs, like dust, chemicals, and especially tobacco smoke. Regular checkups with your healthcare provider are crucial to monitor the condition and adjust treatment as necessary. For a small number of people with severe sarcoidosis that doesn't respond to medication or who have life-threatening complications, surgery may be required. This could involve a lung transplant in the most extreme cases or other procedures to manage specific complications. It's important to remember that the goal of sarcoidosis treatment is not necessarily to cure the disease, as it often resolves on its own. Instead, treatment is aimed at controlling symptoms, improving organ function, and preventing complications. This is why it's so essential to work closely with your healthcare provider to develop a treatment plan that's tailored to your specific needs and circumstances. Sarcoidosis can be a challenging condition to live with, but it's important to remember that you're not alone. There are many resources and support groups available to help you navigate your journey with sarcoidosis, and advances in medical research are continually broadening our understanding of the disease and improving treatment options. So, while sarcoidosis may have introduced a new and unexpected chapter in your life, with the right treatment strategy and a proactive approach to managing your health, it's entirely possible to turn the page and continue writing your story. With the right treatment, many people with sarcoidosis can lead a normal life. But let's summarize what we've discussed today. So, what have we learned about sarcoidosis today? Sarcoidosis, as we've discovered, is an inflammatory disease that can affect almost any organ in the body, although it's most often found in the lungs and lymph glands. It's characterized by the formation of tiny clumps of inflammatory cells known as granulomas, which can alter the normal structure and possibly the function of the affected organ. When it comes to the causes of sarcoidosis, there's still a lot we don't know. It's believed to be associated with an abnormal immune response, but exactly what triggers this response remains a mystery. Genetic and environmental factors are suspected to play a role, possibly including exposure to certain bacteria, viruses, or chemicals. The symptoms of sarcoidosis can be as diverse as the organs it affects. They can range from general discomfort, like fatigue and fever, to specific issues such as shortness of breath, persistent dry cough, and skin rashes. However, it's not uncommon for sarcoidosis to produce no symptoms at all, leading to cases that are only discovered during routine medical checks. When it comes to treatment, the strategies are as varied as the symptoms. Treatment is not always necessary. In many cases, sarcoidosis resolves on its own. However, when treatment is required, it usually involves medication to reduce inflammation and suppress the immune system. In severe cases, organ transplantation may be considered. In conclusion, sarcoidosis is a complex and often misunderstood disease. Although it can be daunting, gaining a deeper understanding of its causes, symptoms, and treatment options is a crucial step towards managing it effectively. If you or someone you know is affected by sarcoidosis, remember to seek advice from a healthcare professional who can provide guidance tailored to individual needs. Remember, knowledge is power. Stay informed and stay healthy. This information is an educational aid only. It is not intended as medical advice for individual conditions or treatments. Talk to your doctor, nurse, or pharmacist before following any medical regimen to see if it is safe and effective for you. Want more videos like these? Please like and subscribe.